I want to welcome everybody to the Resident and Family Support Council meeting. As a reminder, we have these meetings on the first and on the second and the fourth Tuesday of every month at 3 o'clock. And the link that you use to join this meeting today will always be the same link to join every meeting. So that makes it nice and easy to be able to participate in these. So please do feel free to share this link with anybody that you know that may be interested in any of the variety of topics that we have for these meetings. And speaking of the topics that we have a variety of different topics, and you can access all of those topics two ways. One is if you go on to the Illinois Department on Aging's website, and then you click on the Ombudsman page, and then the Resident and Family Support Council resource page, you can be able to see what the topics are there that we've covered. And from there, you can also click on the link to our YouTube page, which is Illinois Ombudsman, that you can connect to actually see and listen to all of the videos that we've recorded for these meetings. We have probably by this point over 35 recordings there on a variety of different topics that really might be able to help you navigate this difficult path of long-term care. Our motives for these meetings is to empower people with information. And we talk about so many different topics. And one of the things that can be an uncomfortable topic to talk about sometimes is this advanced directives topic. And what does that look like? How do I be able to put forth my wishes for what I want the end of my life to look like? And because of that, and from the feedback that we've received from people about how confusing this can get, because there's so many different things out there, that we thought we would have this conversation today. So we actually have two people that are joining us for this conversation. One is Ann Perron, and I'm not sure, Ann, if I'm saying your name right, and the other is Eddie Moran. I'm going to first go ahead and I'm going to introduce Ann. Ann, are you on? I did not see your name.
Hi, yes, I'm here.
There you are. Great, Ann. It's wonderful to meet you virtually like this. So Ann, I wanted to just start with you being able to share a little bit about who you are and what organization you work for, because I think this can also be really valuable information for people.
Yeah, sure, absolutely. Did you want me to start a PowerPoint or just
a little bit about who you are first? You can start scrolling to get to your PowerPoint if you want while you're doing it, but share just a little bit about who you are.
Sure. So I'm Ann Perron. I'm a supervising attorney in the West Suburban Office of Prairie State Legal Services. Prairie State is a civil legal aid organization. So we provide legal services, legal representation for free, and on civil legal matters. So not criminal, but in the civil legal realm. Our Prairie State operates in about the northern third of Illinois, but we have really great partner agencies that cover the rest of the counties. So all of Illinois has at least some legal aid provider somewhere in each county. And I work out of our West Chicago office that serves DuPage, Kendall, Kane, and DeKalb counties, but we have similar services kind of all throughout.
That's great. So this is also a resource for people to be able to share if they have issues with being involuntarily discharged, and things along those lines if they're working in the long-term care world or living in the long-term care world and they're coming across some things that they might need some legal advice for, correct?
Yes, that's right. We do handle involuntary discharge appeals for clients pretty often. And we also handle some public benefits issues, Medicaid terminations, Medicare issues, Social Security issues, and sometimes those things are actually an underlying cause for a problem with the nursing home. So we can sometimes assist clients on both fronts.
Oh, and that's what a fantastic resource for people to be able to have. And it feels like not a lot of people really understand that this resource are available, and there's something available throughout the state. So you might be in the Chicagoland area, but there's also in Southern and Central Illinois, there's other agencies that do the same sort of thing. So if anybody needs any types of services like that, please reach out to your ombudsman, who they can be able to help connect you to somebody like Ann, be able to assist you with any of those services that you may need. And so with that, and I know that this is a conversation that you are very well educated on in regards to advanced directives. So I'm really looking forward to hearing what it is that you have to say. I want to encourage people to put questions into the chat as we are having this conversation. And I know I'm going to be having a bunch of questions myself. So if you'd like to go ahead and pull your PowerPoint up, that would be great. And while you're doing that, I'm just going to, we also have Eddie Moran joining us. And Eddie, if you just want to pop your screen on really fast just to say hi. And she's going to be talking to us about Pulsed, which is another avenue to be able to put down your advanced directives. And she'll be sharing that with us after Anne finishes talking about more of the I don't want to say either one is legal over the other. We'll have Eddie clarify it with us even more. So if you want to go ahead, Anne, that would be great.
Yeah, sure. So you want me to share my screen?
Yeah, that would be fantastic.
All right, I will.
Looks like it's coming on. I'll let you know when we can all see it. Sometimes it's feel like it's just a ticky clock, right? Well, while we're waiting for this to begin, I do want to remind you that Stephen, our guru of the chat, has already started putting in some resources, links to be able to like us on Facebook, as well as the YouTube channel information. You can click on any of those links. Even if you clicked on them now, that way then at the end of the meeting, these pages would be open for you. You can go ahead and like us and or peruse our topics on YouTube channel. And then also, he's also put in there the contact information, be able to get a hold of your local ombudsman for whatever area you live in. I think you might be muted, Anne. Somehow you got muted.
Okay, yeah, for some reason, while I was sharing my screen, it also muted me. So I'm not sure if that'll happen. I can just talk without the PowerPoint too, if that's better.
Okay, well, let's see. It says that you can, could you just try it one more? Could you just try it one more time? Just because sometimes I feel that people need the visual.
Sure.
Okay, but if not, we'll just do the talking.
Okay, I'll just try this way, maybe.
Yeah, I can hear you.
So does this work?
We can hear you. We don't see anything yet, but we can hear.
No.
It just says showing your screen that you started to share, but but nothing is coming up.
Still nothing?
Nothing.
Okay.
Let me just check and see. Yeah, no, it's not coming up. Okay, well, you could just go ahead and talk it. That's fine.
Okay. All right. I will do that. Let me just try to stop sharing there. Okay. Well, I'm sorry about that. So I'll try to be as engaging as I can just with my voice. So advanced directives are a written document that directs families and doctors, agents, and others on various decisions that are effective during one's life. They're created at a time before some event or illness or incapacity takes effect, so that a person's wishes and their desires are upheld, even if they lack capacity at some point further on down the road. So the ones that I'm going to focus on today are powers of attorney for the most part, and living wills, and a couple of other types of documents that you can execute to express your wishes ahead of time. But when we talk about advanced directives from a legal standpoint, what I'm really talking about is the preservation of autonomy and decision making. The whole point of these things, about putting these things into writing ahead of time, is so that you can communicate your wishes and your desires and your beliefs to your family or whoever it is that you're appointing to make decisions for you ahead of time, so that when something happens further down the road, you have preserved that autonomy and you've preserved your own ability to make decisions. Oftentimes, advanced directives in general are tailored to a person's own wishes and beliefs, so they oftentimes can avoid the need for a guardian down the road. And this is important because this can make the transition into a nursing home life, or it can make really, the transition into some sort of illness or some sort of incapacity a lot smoother. And it doesn't have to be crossing over into some line of having decision-making ability and not having decision-making ability, but it helps you to appoint people and empower people in your lives to make decisions with you and not necessarily for you.
So Anne, I'm going to probably interrupt you through the course of this conversation. So I'm hearing you saying that it feels like this is something that we all should be doing. Is there a particular time I should do it? Now that I'm 60 years old, I should be doing it. Now that I'm 70 years old or 80 years old, or should I have? When should I do this?
Yeah, I don't think that there's any bad time to do this. They're also very easy to terminate. So you could, put together a advanced directive now and revoke it later if circumstances change. So there's not really a reason to not go ahead and put these things together now when you have full capacity, when you know what your wishes are for later on down the road. Some people might not think that it's going to do them much good now because they don't foresee a time anywhere in the near future when they're not going to be able to make decisions for themselves or take actions, whether it be through finances and banking or healthcare decisions by themselves. So they might not feel an urge for it, and it's not a necessary thing for like everybody to have if they don't feel like they need it. But there's no bad time to do it. And there's no time when, we would say, oh, you must have this either.
So I don't have to be sick to have this.
Not a power of attorney. Certain types of advanced directives, like a living will really only take effect if you have a terminal illness of some sort. But a power of attorney can be executed in a time of perfect health, or it can be executed at a time where you're just starting an illness. It can be really any time. But that's a good lead me to my next point, that in order to execute advanced directives, whether it be a power of attorney or a living will, you have to be of sound mind at the time that you do it. So you have to have a mental capacity at the time that you execute these documents. The mental capacity means contractual capacity. So the question of capacity can be a gray area. You might have capacity to do one thing but not another, or hold one type of a job but not another. And what we're thinking about when we discuss advanced directives is, do you have the ability to understand what the document is doing, what the consequences of it are? Can you communicate your desires to have this document in place? And do you know what the effect of it is going to be? If the answers to those are yes, regardless of if you have some sort of diagnosis that would indicate a lack of capacity, then you probably do have the ability to execute this document.
So who determines this sound mind? You mentioned sound mind. Who determines that?
So if an attorney is helping with helping execute the documents, and the attorney who's there would decide, because it's a momentary thing. It's a, what is your capacity at the moment that you're signing this document? So the people that are there witnessing and helping you execute the document decide. And that's one of the reasons why there's some limits as to who can be witnesses on these types of documents. It shouldn't be the person that you're appointing to be your agent, it should be someone who's unrelated. It also shouldn't be somebody who's treating you medically in any capacity either. It should be people who don't have that vested interest in what happens with the directive. So the effect of an advance directive, specifically a power of attorney, is that you're appointing an agent to make certain types of decisions for you. And an agent is the person who's going to act on your behalf or make a decision on your behalf. There's two types of powers of attorney in particular. There's a power of attorney for healthcare, and they can make any decisions about personal decisions or healthcare related decisions, and a property power of attorney. And a property power of attorney agent can make financial decisions and can make financial transactions on your behalf if you lack the capacity. So who should we appoint as our agent? An agent should be someone who's trustworthy. The document itself sets out the rules about how the agent should act. But that said, it should be somebody who is an adult and is of sound mind themselves, and who can be trusted to carry out responsible decisions on your behalf. So a question that comes up for us often when we are dealing with families is, when do these powers of attorney begin? When can the agent start making the decisions for the principal, for the person who has written the document? And the answer to that question really is it depends. And it should be specified in the document itself. Sometimes we see a power of attorney that is effective immediately. Sometimes we see that it's effective only when a treating physician makes a determination of some sort of incapacity in writing, or a combination. Like we oftentimes see healthcare powers of attorney where the agent can start communicating with doctors or requesting healthcare records immediately, but they can't make decisions until there's some incapacity that the doctor has confirmed. Let's see, a healthcare power of attorney really has all the abilities or all the decision-making capacity that a person would have, so they can make any decision that the principal themselves could make. But they must act in accordance with the principal's wishes to the extent that those wishes are known. And if those wishes are not known, then they must act within the principal's best interest. They have to consider their best interest when they make those decisions. Powers of attorney of property are a little bit more specifically laid out. The forms themselves will limit the abilities and the duties and the rights of the power of attorney agent right there in the document. And you can take out certain things. You can say, this person can help me make financial transactions, but they're not allowed to borrow money, or maybe they're allowed to sell something in particular or something specific, but they're not allowed to do other types of transactions. You can specify what it is that you want the power of attorney for property to do.
So I just want to clarify, if I am somebody's power of attorney for healthcare, for example, I should have a conversation with the individual to find out what their wishes are, because it's not what I want, it's what the individual, not what I would, like if I'm my mother's, I should have a conversation with my mom to find out what it is that she wants.
Yeah, absolutely. And in fact, it's a duty to make the decision in accordance with what that person would want, to the extent that that's known. So those decisions should be a part of this whole process when you're appointing somebody.
And so I also should be being told that somebody's setting me up as their power of attorney. So like if I have my children, I shouldn't just like do it and not tell them.
Right.
I should make sure that they're aware that they're my power of attorney. And for what? For healthcare or for property, because those are two very distinct things.
Right. Yes, and it's definitely preferable that you tell the person that you're appointing that they're being appointed, but it's not necessarily a requirement. Sometimes people get surprised by that. But yes, it is. I think it's best practice to have these conversations together and make sure that expectations are really clear ahead of time. And then that helps the person who's being appointed know the limits and the things that the person wants them to do for them.
And so this can be two separate individuals, one for healthcare and one for property, but it also could be the same person.
Yes, that's true. It could be the same person. It could be different people. And I also wanted to mention that it might be a good idea to name a successor agent in your powers of attorney. A successor is someone that is named and their information is there so that in the event that the primary agent is unwilling to do their job, to do what they're supposed to do under the document, or they're unable, that the successor can step into that role without an entire new document being written up and executed. So it's certainly not a requirement, but it could be a good idea if you have somebody else who you would have fill the role in the event that the first person could not.
I agree with that wholeheartedly. So that is something, sorry to butt in, that is something that I've seen as an ombudsman where residents will have their power of attorney set up and, pardon my voice, and then for whatever reason, the power of attorney dies or they don't want to fulfill the role. And then that resident, well, maybe their capacity's gone. And so the nursing home is either scrambling to figure out who to take direction from, or they're trying to find a guardian. One of the things I tell people when I'm talking about power of attorney is when you pick your successor, make sure it's not a person that's going to be in the same car as your primary agent. Because if you've got a husband and wife who are your agent and successor, if the agent gets into a car accident, wife's probably going to be there too. If the husband is financially exploiting you, the wife's probably in on it too. That's just a little tidbit that I like to share with people. That's all I have right now.
Thank you, Stephen. I like the new voice.
Here.
Thanks.
Hello, everybody. Veronica here. I have a question real quick.
Mm-hmm.
When does the power of attorney end? Does it end at death, or does it end after the person's services has been done?
That's a really good question. And there's a few different answers, because it can be, in your power of attorney document, you can specify an end date, in which case it would end upon that event or that date. And in some but for the most part, the general answer is that powers of attorney are really only effective during a person's lifetime. The one small exception to that is with a healthcare power of attorney. Sometimes the agent will also be able to make certain like organ donation or decisions about remains or medical records after a person's death, but that's a very limited exception to that. But that being said, it can also be revoked at any time, in which case the agency would end at that point, or the document can specify some other end date as well.
I mean, I'm sorry that we keep interrupting you, but these are things that we see here. If somebody has a power of attorney, I'm in a long-term care facility, I have a power of attorney, I go to the hospital, and that hospital says to me, do you have a power of attorney? At that point in time, I may still be decisional. I can't remember though if I did or if I didn't. So they're like, well, do you want to get that happen? And I'm like, yes, absolutely. But I already had one. I didn't remember that I had that. So I get a new one instituted. It's a different individual. Now what happens?
So that's a good question too, because you know, I haven't talked about it yet, but one of the ways to revoke a power of attorney is by executing a new one. And you know, especially most revocations or most new power of attorneys will include language that says it revokes any previous power of attorney document that was made. So in most cases, executing a new one with a new individual is going to revoke the previous one. And so that would change who the agent is.
Got it. So then that other person is no longer, it will just be the new person that I designated as my power of attorney.
That's right.
Which basically,
right.
You're going to be looking at the date. You're looking at the date to see which
right.
is the
right. If you're approached with two different powers of attorney for different people, in most cases, the more recent one is going to be the one that's effective.
So if I go back to that long-term care facility, I need to get that other one because I may have changed my mind. I may want that person to still be at the one that I designated while I was in the hospital.
Yeah, and it's always a good idea to keep these on you too. It's a good idea to keep them in a good place and to maybe have them in your purse, or on your person somewhere, especially if you're dealing with something that is affecting your memory, or is you know, you have good times and bad times during the day where you may not remember something like that.
I have my mother putting it, she has it on her refrigerator. My mother's 89. So I said, you know, Mom, just put it on a refrigerator. That way, then if any emergency did happen and any, you know, paramedics need to come into your, you know, your condo or whatever, they'll see that your daughter is your power of attorney for healthcare, and they'll know right away they can reach out to me. They have to go looking for my phone number. Everything would be all together. So that's what we're doing, just as a little hint for other people that may have their loved ones at home.
Yeah. So I want to make sure that I talk about the duties of a power of attorney for property or a property agent. So a power of attorney for property agent is going to have more, you know, specific duties, more obligations, more responsibilities than necessarily one for healthcare would. And among those are that they must act in good faith and in the best interest of the principal. Meaning that you have to pay all the bills, you need to make responsible financial decisions. You have to act with competence and diligence, meaning that you need to be aware and take advantage of any public benefits issues that might be coming up and make sure that you're taking advantage of all those. Using due care, meaning you're keeping the records safe and confidential on behalf of the person who's trusting you to, you know, preserve and be a good steward of finances. And you have to make sure that you're recording all receipts and disbursements, any significant actions that the agent might be doing with the principal's finances. Under the statute, a power of attorney for property agent must provide an accounting upon request by certain people. The principal themselves can request an accounting at any time, and the agent will have to give it. A guardian of that principal, if there is one, some other fiduciary, the court can order that agent give an accounting, or notably an APS agent or some agency that's investigating elder abuse and neglect.
So APS would be Adult Protective Services?
Right, they can request an accounting, and the agent will have to give one. So it's important to keep good records, basically making a note of taking very good notes about everything that's being done with the finances. In general, there's some good things to avoid as an agent. You really want to avoid joint ownership with assets if you can with the principal. Borrowing money from the principal is definitely something that nobody wants to see. Trying to avoid any conflicts of interest. So that would be using the principal's funds to maybe purchase something from the agent themselves where they would profit off of it, is something that you need to be careful about or just don't do at all. And making gifts is also something to be really careful about. Powers of attorney, we've mentioned this a little bit so far, can be revoked. There's several different ways to revoke a power of attorney. And the general rule of thumb is it can be revoked at any time. One way that we just talked about was executing a new power of attorney. But you could also just write a statement saying that you just want to revoke a power of attorney. You don't want to do a new one or appoint somebody new right now, but you do know that you don't want this person who used to be appointed as your agent to act as your agent anymore. You know, the mental capacity and sound mind at the time of executing a power of attorney is very important. And it's also important to note that that might be a different distinction than a revocation. It's a little bit simpler of a question to say that you don't want something or you don't want somebody to have access to your finances or make healthcare decisions, than that you do want somebody to do that and all the consequences that that might have. So when we're talking about capacity, it really is a question of what is the task at hand? What is the effect of this document you're about to sign, and do you understand that? And it could be a much simpler question, or someone could have more diminished capacity but still have the ability to revoke a power of attorney because they do understand and can communicate that they don't want this person to have that power anymore. So that's a lot about powers of attorney, and please let me know if you have questions about that, because I was going to move on to living wills, but if somebody has questions about power of attorney, I'm happy to ask that.
Well, it was noted in the chat that that several bills have been introduced this legislative session that may amend the Power of Attorney Act, and the Department on Aging is actively monitoring this legislation. The information will be disseminated in the future if the law is amended. And we did last year, we did do a legislative summary after all the different changes that occurred through legislation in the spring session. We did that last year. And so we probably will do that again this year, because there's a couple of things out there that might be affecting us in that long-term care environment. So if anything happens, Karen, you're right on. We will make sure that everybody gets any of that information.
Yes, and I should note, and more specifically, there's been a couple changes to the healthcare power of attorney, and there are statutory forms available for these two things, and they're not necessarily requirements.
Could you explain what the statutory form?
So the statute that creates the Illinois Power of Attorney Act has included with it a form that any form written by an attorney or some other person who's drafting it needs to substantially comply with that language. And so it's not like I said, it's not a requirement to use that, but it must substantially comply with it. And it is a good resource to, really just copy that and fill in the information as it's used, and making sure that you're acting off of the most recent changes, or the statute as it is effective now, is important.
So how can I access that if I'm somebody that's listening to this right now and I do not have a power of attorney? How can I access that legislation so I can just get that form directly and not have to worry about it?
Yeah, sure. So I'm going to look at my PowerPoint that I know I can't share right now, but I did, include some resources and websites that will include a lot of really great information.
And we can put this on our, if you'd like to send me your PowerPoint, we can put that on our department's website page. And that way then all the links will be clickable as well. So people will be able to get into the PowerPoint and be able to click on these links in the future. If you're either watching this in the future or currently you're driving, you're in a car or whatever. It looks like we did get Karen from the Department on Aging. She went ahead and she dropped the link in there for us as well. So that's fantastic.
Thank you.
Karen.
Thank you. Yeah. All right. So I'll move on for a second to living wills. Living will is also set out by statute. It allows you to choose not to get or to get medical treatment that delays your death when there's no other treatment available to cure. And this can happen when you're sick or unconscious and you can't tell your doctor or your family what type of medical treatment you want. And if you have a living will, then that would be referred to. So this is something that you can draft now, or you can draft at any time, but it will only really be effective if a doctor says that you have a terminal condition and records that in your medical record.
It has to be a terminal condition.
Right.
Got
But the
it.
living will can help your family because it tells your doctor what you want. If you have a terminal condition, your family doesn't have to make that difficult decision about the extension of life or not. And if you don't have a trusted person that you would like to appoint as a healthcare agent, the living will can help make sure that your views on the end of life circumstances are followed by the people who are making those decisions.
Can I have both? Can I have a power of attorney as well as a living will?
You can, but if you have a power of attorney that you have an agent named, then that person is going to make the decision for you. But as I said earlier, a power of attorney is required, or a power of attorney agent is required to take your wishes and decide in accordance with your wishes to the extent that those are known. So if you have a living will that sets that out, then in effect they're bound by those decisions because they're acting within your wishes. But it is important to note that the living will can, so in the event that you don't have an agent appointed for healthcare, and you don't have something like a living will, your doctors might follow what the Healthcare Surrogate Act, which is essentially a statute that sets out, which family members or which people they can rely on to make these decisions in the absence of some sort of advance directive. And if you have a living will, that will supersede that Healthcare Surrogate Act, and it will let the people who are making those decisions know what it is that you wanted. The living will, it's important to note, it doesn't prevent your doctor from providing comfort care or care that alleviates pain. And it doesn't allow your doctor to withhold or withdraw artificial nutrition and hydration like a feeding tube from you if the death would really only result from that removal rather than from the terminal condition itself. These are potentially also available on IDPH, like Karen says, or Illinois Legal Aid is another great resource that I had in my PowerPoint, but it is a really great resource that I hope that people look at.
Do you need a lawyer to do these things?
So not necessarily. We would I think it's a good idea to have a lawyer go through everything and talk to you about your specific circumstances, what it is that you want and what you might need. They may have really good ideas or have better, be able to talk you through your specific circumstances a little bit better. But the language for a lot of these things is relatively boilerplate and is set out through the statute. So in a pinch, it is possible to just get these forms and fill in the information and make sure that they're witnessed appropriately too. But if you have time to discuss with the lawyer, it's probably a good idea because everybody's situation is different, and everybody would benefit from a conversation that's tailored for them.
I just want to clarify that a power of attorney does not go into effect until I can't make a decision for myself. So if I'm in a nursing home and I can articulate what it is that I want and I need, and my daughter's my power of attorney for healthcare, and I don't want to have 3 meals a day, I only want to eat dinner, and she wants me to eat dinner, and she says, well, I'm your power of attorney, so now you've got to eat 3 meals. That can't happen, right? I'm like, no, I don't want it. I'm still in control of my decisions just because she's a power of attorney. It doesn't happen until I can't make a decision anymore, correct?
Well, so it really depends on what's written out in the document. A lot of times that's how we like to draft documents if a person wants to make sure that they maintain their own autonomy and decision-making for as long as they can. But it's possible to draft a power of attorney that transfers that, I won't say transfers, but that allows that power to take place immediately. But I will qualify that with the note that if you do have an agent, an appointed agent for power of attorney, it doesn't mean that you no longer have the ability to make your own decisions. That's why it's distinct from a guardianship. With a power of attorney agent, you still do have the ability to make your own financial transactions. You can still write your own checks. You can still make your own decisions. You can still talk to your doctors and make your own decisions, even if you have a power of attorney agent who's also able to do those things. So it's something that if you lose capacity, then that person is in place to make them on your behalf, but it doesn't take away any of your own rights or autonomy to your own decisions.
So I do want to let people know, if you have questions about guardianship, besides reaching out to your ombudsman, which Stephen put the contact information in, you can do that. But we also did do one of our Resident Family Support Council meetings on guardianship previously. So if you go on the YouTube channel, you could be able to view that to get more information about guardianship. But there are, we have encountered as ombudsmen frequently where a nursing home, for example, may say, your daughter is your power of attorney. She wants you to have a bath every day. We know you don't, but because she's your power of attorney, you're going to get you're going to get a bath every day because we're listening to her, not you, because she's your power of attorney. Is that proper or not proper?
Well, I would say that it's probably not. And that's based on an assumption that, that the resident themselves has their own decision-making capacity, and they don't have a guardian either per se. But, we do see that happen relatively often when an agent is saying one thing and a nursing home or a supportive living resident is saying another. And the facility is making the decision based off of the agent. And that shouldn't be the way that it is, because appointing an agent, even if that agency is taking effect immediately, it's really about having this person make decisions, with you, or be able to step in the event that you can't. But it doesn't take away the reason why you do it ahead of time before there's an event or incapacity, is because you are able to preserve your own autonomy and your own independent decision making ability for as long as possible. So to the extent that you can communicate your own desires and wishes, those should be honored.
So I think that that's an important message for us all to hear from this, is that just because I have a power of attorney doesn't mean that it goes into effect immediately. It goes in, unless if it is written in that manner. So I should really make sure that I read that and I understand that, and that the facility continues to listen to me. I have not given up my voice just because I have a power of attorney. So I think that's a very important thing, because I feel like sometimes we do lose sight of that in long-term care facilities. I did also, at this point, I want to introduce Eddie. Eddie, if you want to go ahead and say hi to us all and turn your screen on. Eddie is going to be talking about another very, very important tool for us all to be fully aware of that also supports our end-of-life decisions, and that is PULSed, the PULSed form. And Eddie, are you able?
Yeah, I'm here.
Okay.
Hi, everybody. And it's actually Edie.
Edie.
I'm Edie. Yeah,
Got
no
it.
worries.
Okay. Thanks,
My name is
Edie.
Edie Moran. Sure, I'm Edie Moran. I'm a licensed clinical social worker here in the state of Illinois. I'm also an advanced palliative and hospice social worker. I work for ProMedica Hospice, which is one of the largest nonprofit hospices in the country. And I am honored to be a member of the Illinois PULSed Committee. So I'm on the committee that works to advise the state on the PULSed form and do advocacy, education, and really outreach in whatever we need. So, or whatever you might need.
Yes.
Let me see, I'm gonna try to share my screen too and see if that works.
While you're doing that, if you could just share with us, what does this PULSed stand for?
Sure, PULSed stands for the Practitioner's Order for Life-Sustaining Treatment. So this is can you see my screen?
Yep, we got it.
Okay, great. So this is the PULSed form. It's also known as oftentimes as a DNR, a do not resuscitate, but it goes much further than a typical DNR form would. So what is the PULSed form? I think that that's the biggest part that people are oftentimes a little hesitant because they don't really understand what it is. Well, like I said, in Illinois, it stands for Practitioner Order for Life-Sustaining Treatment. Therefore, because it's from a practitioner, it must be signed by the person it's for, you know, and their legal decision maker and a qualified healthcare practitioner. So a doctor, an advanced practice registered nurse, a physician's assistant. It has to be signed by one of those three. But what's really important is that a POLST form is only filled out after you talk with a doctor or another healthcare professional. So you want to make sure that you're talking to the people you know and trust to emphasize what's important to you. Talk about the choices that you want them to make if there's an emergency and you can't make your own decisions, and put your treatment wishes on the actual form. You know, there's a space on the form to include anything that's not outwardly addressed on the form. You can write in your own area. I don't know how to make this go forward. Do I just click? I just click. So most older folks today are too healthy to have a POLST form. But many people who are in a nursing facility should consider discussing it with a healthcare professional. So with your doctor, your advanced nurse practitioner, or your physician's assistant. It's really recommended for people who are sick with a serious illness or very frail, or someone living with dementia who may lose the ability to make their own decisions. Those are the two populations that really the POLST form is for. If we go on, there's 4 sections to a POLST form. The first one considers what is going on if your heart is not beating. So let's say your heart has stopped beating. Do you want the emergency team to try to start it again with CPR, cardiopulmonary resuscitation? So those are chest compressions. Section 2 is if your heart is beating, but you're very sick and can't breathe well, would you want to go to the hospital and be put on a machine to help you breathe? Put on a ventilator. Section 3 says, if you get very sick and you already have a serious illness that will get worse, even if you take medication, do you want to be kept at home and treated for pain and suffering, but not try to get better? So comfort-focused treatment, that's really where hospice care comes in. And then the 4th section is if you can't or don't want to eat food or drink water, do you want to be fed through a tube placed in your belly or placed through your nose or a vein in your arm, or not receive artificial nutrition? So these are important questions, because if you're not able to tell us in that moment what you want, we need to know. And what's really beautiful about the POLST form is that it is a physician's order. So it holds the same importance as any other order from a doctor. But remember that filling out POLST is a choice. Number one, most important, it's a choice. No provider, no facility, no person should insist that you have to complete a POLST form. It is your choice. Even if you're on hospice, it's your choice. You can also void or change a POLST form whenever you want. When you fill out a new one, like the power of attorney paperwork, when you fill out a new one, the old one is no longer valid. It's always a good idea to have someone with you trust, who can help you make sure you understand your options and to make these decisions. That would be a great time for the person that you appointed for your power of attorney for healthcare to go with you to your doctor's appointment and talk to your doctor about the POLST form. Here in Illinois, because it is a practitioner's order, healthcare providers must do what is on the POLST form as it says by law. But if you don't have a POLST form, the emergency team will try to keep you alive with all treatments available, including chest compression, CPR, and anything else that you may need to help keep you alive. I think the most important thing that you need to remember is that when your health conditions change, or when you have a hospital stay, you should discuss the POLST form again with a healthcare professional. So this is a living document. This is a document that changes as your health conditions change, as your hospitalization changes, as your living situation changes. You know, if you get a new diagnosis, that is a great time to have a POLST conversation and figure out if you need to revisit your POLST form. There are a few benefits for the POLST form, which is really exciting for me. And this is really where my passion as a practitioner comes in, is that we use the PULSE form to make sure that every person receives the treatment they want and that we avoid the treatments they don't want in a medical emergency or if their heart stops beating. Because there will come a time where all of us will meet our end. You know, it's a normal part of life. And if you want a quiet, calm, peaceful death, then that's what we're going to give you. And we're going to respect your wishes, and we're going to make sure that we don't do any treatments that you don't want. This PULSE form also shares choices about treatment and gives clear instructions for family and facility staff, or when transferring a person to and from the hospital. So it just makes it clear for everyone involved in your care exactly what we should be doing. And then this allows a long-term care facility to contact 911 in a critical medical emergency without the fear of the resident receiving unwanted treatment. You know, so that's a big one. I think people don't understand. Oh, if I sign a PULSE and I'm in a facility, then they're never going to call 911 and they're just going to leave me there to die on the floor. And that is not at all the case. We would still contact 911 if there was a medical emergency because we're required to, but those emergency personnel that come in when 911 is called will know exactly what kind of treatments are appropriate, whether or not to put you on a ventilator, whether or not to give you CPR, whether or not to admit you to the hospital, or if it's not a serious incident, then we'll put you back in bed and let you rest and keep you calm and peaceful and pain-free and happy. And that's really where I think the PULSE form comes in to the most benefit. And that's it. It's quick and easy. I want to make sure that I leave some time to answer questions for everyone because I know that there's probably lots of them. This is a delicate subject.
The first question I have is, what's the difference between a PULSE then and a DNR? I do not resuscitate order.
Yeah, so a DNR is just about what happens when your heart stops beating, whether or not you're going to get chest compressions. It's all about CPR. A PULSE form takes the form of the DNR, the information on the DNR, and also extends it then into what happens if your heart is beating, what happens if your heart is not beating. Do you want artificial nutrition? Do you want to be put on a ventilator? Like all of these, what kind of focus do you want your care to take should there be a medical emergency?
We have a question, Elizabeth. Did you want to unmute yourself and ask your question?
Yes, please. Can you hear me?
Yep.
Yes. Hi, Elizabeth.
Yeah. Hi. So my question is that I've seen where the PULSE form is filled out and it's like, so for a full code, but then I've heard staff reference like, oh, a full code's not really a PULSE, but isn't it? I mean, it's the form, it's where they're choosing it.
Yeah.
So I get kind of confused when it's a full code, and is that really considered a PULSE?
Right. So you can fill out.
Can we explain what a full code is?
Yeah, sure. So a full code means that we're going to do everything in our power to keep you alive should something happen. You know, that means that we're going to pull out all the stops. Someone who would be labeled, you know, and I don't like the term full code because it's that medicalese that I don't love. It's jargon, right? But a full code would say if you're in a long-term care facility and your heart stops beating, we're going to do chest compressions. We're going to call 911. We're going to take you to the emergency room. We're going to put you on a ventilator if we need to. We're going to put a feeding tube in if we need to. We're going to make sure that we do everything in our power to keep you alive. Now, that is kind of the basis for treatment, right? Like if I'm walking down the street at 40 years old and I have a cardiac arrest and my heart stops beating and I collapse on the street, I could be labeled a full code because when emergency personnel arrive, they're going to do everything in their power to save me. Now, it gets a little more sticky when people are closer to the end of their lives or are on hospice or are receiving palliative care or have an incurable serious illness, because some people want to have everything done. And that's when we would label them a full code. Now, you can fill out a PULSE form to say that you are a full code, but that's like, it's a little redundant because you're already a full code. The PULSE form really is to reinforce the patient's wishes should it be something other than being a full code, you know, being wanting every single treatment. Does that make sense?
Yes,
Yeah.
thank you. That
Oh, you're
definitely
welcome.
clarified. And in my experience, it's usually the family, that wants the full code, wants all the stops, and the
Right.
person's aging, and they're just having a difficult time, accepting
Yeah.
that.
And that's really where, a social worker like me could come in really handy, to be able to have conversations with the patient and the family to say, like, your COPD is not going to get any better. And if we try to do chest compressions, we're going to end up breaking most of your ribs and your sternum. You're going to be bruised. You're going to be in immense amounts of pain. And we probably won't get your heart started again. That's an example of a conversation that you can have when you are discussing pulse form with your doctor, your nurse practitioner, or your physician's assistant.
Great. Thanks so much.
It sounds like we really need to have some educated conversations with people.
Yes.
Whether it's our doctor, whether it's our family members, especially if we have, a power of attorney for our healthcare as well. So you can have a power of attorney and you can have a pulse.
Mm-hmm. They're two separate forms.
And I would probably want to share the pulse with my power of attorney so they can understand what my wishes are. And that would also facilitate that conversation.
Right. And if you live at home, I know that this is a long-term care group, but if you do live at home, you should put it on the fridge, just like you were talking about with your mom and her power of attorney paperwork. Put the pulse form right there with it so that if someone comes into the home, EMS is trained to look at the fridge. So that's a really good place to put your pulse form, your power of attorney form. I also tell people to keep a copy of your pulse form and your power of attorney form with your medication, so that if you do end up going to the hospital, you can just grab everything all at once and you're out the door.
I'm curious if any of these, I know like we were talking about this the other day in our office. There's my chart that like my affiliate physician has me be able to look at my chart stuff. I'm curious if there's a place for me to be able to download my advanced directives into that. Do you have any idea? Just out of curiosity.
I would assume that there is. The electronic medical record that we use at my office has a place for us to store attachments that our patients provide us. And so that's where we keep their advanced directives. So I would assume so. I would ask your doctor. Yeah, I would assume that there is.
That might be another hint in this conversation, is to ask your physician if they do an electronic medical record in any way, if they can put that, make sure they've got a copy of that and they have that in your records, so that they can very easily, if they contact your physician, very easily get that to the emergency provider if an emergency situation happens. Sounds like that's something that's needed.
And I also tell family members a lot, snap pictures with your cell phone of your power of attorney paperwork and your pulse form, so that you have your loved one's needed needed documents there on your phone ready to go, so that you can email them if you need it. You can print them out. You can show them to medical professionals. You'll have them handy with you all the time. So that's also a good kind of practice to get into.
So I just want to clarify the way what one of the comments you said is that if somebody's healthy, you don't necessarily initiate a pulse. That would be something that would be happening if you have a terminal illness. So if I'm a healthy 89-year-old, I don't need a pulse. I wouldn't.
If you're 89 and you've had the conversation with your loved ones and your power of attorney surrogate that you've already picked, and you've got all of that executed, and for certain, I'm 89 years old, I'm in good health now, but if I start going downhill, I just want to stay home. I don't want to go to the hospital. I've never had any interest in going to the hospital. Then you would need a pulse. If you're not interested in that aggressive treatment, the full code, every stop being pulled, that's really when you need a pulse, regardless of your age. It's really
of your health condition as well.
Yes. So anyone can have a pulse. Anyone can fill out a pulse. You just have to have a doctor's signature on it, and then it's a valid legal document. Once it has your signature and a doctor's signature or nurse practitioner or physician's assistant signature on it. But the people who need them are older folks and people who have a life-limiting chronic illness, serious illness.
So it sounds like a pulse is really like a DNR on steroids. It's a super DNR.
Yeah, it covers a lot of what the DNR does, but then also adds in a few more areas of information.
And I really feel that the message that we heard from both you and Anne today is that there's a couple of things. One is that these are living, breathing documents. We can change them when we want to change them. We never lose our empowerment to make our end-of-life decisions. And we should be able to do that and think about this stuff. We need to be communicating this to those that we are putting in those decisional capacities. I think that that's a very important message that I heard today. And that one doesn't supersede another, that you have a pulse, you can also have, your power of attorney, that's all important. It doesn't mean I have a pulse, so I don't need the rest of that stuff.
Right.
I probably would want to go ahead and make sure that I've got all my ducks in the line so that I have that end of life care the way I want that end of life care to look like.
Mm-hmm. Absolutely. Absolutely.
Well, I so much appreciate Anne, I appreciate you being on today. Edie, I really appreciate you being on today. What great information. I really encourage for people to share this with others that are having these difficult times wrapping their head around all of this stuff, because it can get very confusing and it's not a conversation that we want to talk about our own death. But news to everybody, we're going to die eventually, right? We all are going to die. And so that brings us to what our next conversation is going to be on the 28th of this month. Our next meeting, which is the fourth Tuesday of the month, is going to be on end of life, what person-centered end of life care should really look like for yourself. And so not only just talking about the legalese of all of this, but also the other things that you should be able to articulate as you're ending that, as your life is ending. What should that look like for you, and what do you want that to look like? And we have somebody from a hospice is going to be coming and talking with us about that. So again, we want to make sure that people feel empowered throughout life, and that includes the end of what that life can look like. I'm going to go ahead and I'm going to put the poll up really quickly. If people could please answer the poll, that would be fantastic for us. And again, I just want to say how much we truly, truly appreciated this conversation today. If anybody has any further conversations, I'm just going to go ahead and stop the recording right now. But please do feel free to stay on, and you can ask any questions if you would like.